Thank you so much for joining the Vaughan Public Library's program, Eating Disorders, the Shadow Pandemic. My name is Rachel, and I am the Health Literacy Specialist here at Vaughan Public Libraries. This evening, Dr. McSheffrey will be providing a brief overview of the increase in the incidence of eating disorders during the pandemic, the medical consequences of eating disorders, and some suggestions for parents who suspect that their child may have an eating disorder. This session is being recorded and there will be time for a Q&A at the end, so please save your questions until the very end. I'm going to admit a few more people, but in the meantime, I'm going to hand it over to Dr. McSheffrey to start his presentation. Thank you so much for joining us this evening.
My pleasure, Rachel. Thank you so much. Let me get my presentation going and then we'll get started. And Rachel, can you see that okay? Okay. So hi everyone, my name is Dr. Gordon McSheffrey, and I'm what's called a pediatrician and adolescent medicine specialist. And I'll be talking tonight about eating disorders, and in particular, this concept of the shadow pandemic. And really, we'll talk a little bit about the dramatic increase in eating disorders and their severity, particularly among children and teens that occurred during the COVID-19 pandemic. So just about myself. So I am as I said, a pediatrician, and I'm what's called a subspecialist in adolescent medicine. So what that means is we first train to become pediatricians, and then afterwards we do additional training and then choose a subspecialty, and mine is called adolescent medicine. I completed almost all of my training at the hospital for sick children. I practice at Boomerang Health, which is a pediatrics clinic in Vaughan, as well as I work for the Scarborough Health Network and for the Center for Addiction and Mental Health downtown. I just wanted to say that I don't have any conflicts of interest to disclose for this talk, and I have not received any financial compensation for this session. Now, most people I don't think have heard of adolescent medicine, so I just wanted to take a quick minute and sort of describe what we do in my field. So as I said, we're part of pediatrics, and our particular scope includes things like eating disorders, which is of course the topic for tonight. We also have expertise in substance use disorders, gender affirming care. We do see and help teens with some mental health conditions like depression and anxiety. I also see a lot of teens and help them cope with chronic illnesses like type 1 diabetes, cystic fibrosis, lupus, and we also provide sexual and reproductive health to teens as well. So that's the field of adolescent medicine, but tonight we'll be focusing mainly on eating disorders. So this concept of the shadow pandemic, first of all, I just want to acknowledge that I did not come up with the term shadow pandemic. That term's been used previously by a colleague of mine, Dr. Sam Martin, who's an adolescent medicine specialist at Northwark General Hospital. And it was also the title of a review by my colleagues at McMaster and CHIO, Dr. Couturier and Dr. Norris. But essentially it refers to this really eating disorder crisis that co-occurred with the COVID-19 pandemic. So what actually did happen during the pandemic? Well, for one thing, the diagnosis of an eating disorder called anorexia nervosa almost doubled in teens throughout the pandemic. So almost twice as many teens every month were being diagnosed with anorexia nervosa for the first time compared to pre-pandemic levels. And then, unfortunately, as we'll talk about in a little bit, people with eating disorders frequently need to be hospitalized because they're so physically unwell. And during the pandemic, for both teens and adults, there was a 48% increase in people who had to be admitted to hospital related to an eating disorder. And then if we break that down a little bit more and look specifically at children and teenagers, there was a dramatic 83% increase in those children and teens who had to be admitted to a hospital because they were so physically unwell. Now, in addition to being admitted to hospital, what we found was that children and teens also had more severe eating disorder symptoms, and overall, physically, they were more unwell. And when we say more unwell, we mean things like more their heart had suffered greater damage, bone marrow failure, liver failure, very low weights, In general, the severity of the symptoms we typically associate with eating disorders also got worse. And then one of the other things that was noted during the pandemic in the context of lockdowns, in the context of reducing in-person appointments, in the context of many programs struggling to figure out how they're going to operate within the new restrictions, or the restrictions at that time, there was also reduced access to eating disorder treatment at a time when more people needed it, and needed it even more than they did before. So this was all of the things that sort of contributed to the shadow pandemic. And of course, many of us have asked the question, why did things get worse during the pandemic? What was contributing to this dramatic increase in eating disorders, and how severe they were? And some of the factors that have been examined include the loss of routine that happened, and also changing routines, because there were so many, as most parents will appreciate, so many lockdowns, virtual school, changing back to in-person school. There was a loss of structure, and also a loss of all of the regular milestones that we expect in our lives. And so I'm talking about important milestones for children and teens, like graduations, birthday parties, the prom, sports, all of those other things that are super important parts of children's lives were also affected. I had more than a few patients very articulately say to me that I have lost control over every part of my life. I can control my eating, so I'm going to control it. And so that was a very prominent theme that many patients were expressing to me during the worst of the pandemic. Certainly the social isolation played a role. And then of course we can't ignore the role of social media. And so we certainly observed during the pandemic that there was a lot, social media has always had an impact on eating disorders, but I think it was more prominent during the pandemic. Certainly on social media outlets like TikTok, more videos about losing weight, about body image. A lot of teens expressed to me the theme of, well, we all should be losing weight during the pandemic. We're all at home and we should be working on this. And so there was just a lot of negative messaging from social media, and still a lot of negative messaging coming from social media. So this really is what we mean by the shadow pandemic. And sort of we've described a little bit about how things got a lot worse during the pandemic. Now, in terms of what are eating disorders, well, eating disorders are defined as any disturbance in feeding and eating that results in negative physical health and mental health consequences. And so there's several different types of eating disorders, and I'll briefly explain some of them. I think many people have heard of anorexia nervosa and bulimia nervosa. There's also a type of eating disorder called ARFID, or avoidant restrictive food intake disorder. And again, I'll explain a little bit more about what that is. There's also something called binge eating disorder. And then there are a number of other eating disorders, which I'm not going to speak about directly tonight, but those include things like rumination syndrome, pica. Pica is when a person eats inorganic material. So for example, I've had a patient who was eating drywall. Pica also something typically, not typically, but that can happen during pregnancy as well. But our talk will focus mainly on anorexia nervosa, bulimia nervosa, and ARFID. So first, I would like to talk just a little bit about what we call the disorders of body image, and that's specifically anorexia nervosa and bulimia nervosa. So these are two disorders that really focus on the concept of distorted body image. And what that means is how an individual perceives or experiences their body is very different from how the people around them perceive or experience it. And frequently that manifests itself as feeling that the person is feeling that they're too fat, that they need to be thinner. Even if they're already significantly underweight and unwell, they still have this body image that there's ongoing, that they're too fat. And often the people around them are not able to see this. We can't see what you're talking about. We can see that you're very thin and look unwell, but then you're telling us that you still feel that you feel too fat and that you need to continue losing weight. Both of the disorders as well as part of their diagnosis, have a fear of gaining weight, or maybe also behaviors that interfere with gaining weight. And so really gaining weight, the thought of gaining weight is like a phobia to these individuals. They're so afraid that if they gain weight, every bad thing you can imagine is going to happen. They're going to lose all their friends, they're a terrible person, all of these things. And so that fear of gaining weight is a hallmark of both of those disorders. The difference then between anorexia nervosa and bulimia nervosa is in anorexia nervosa, a person has intentionally done something to lose weight and are generally very unwell, physically unwell and mentally unwell. There are different subtypes of anorexia nervosa. So one is called the restricting subtype. By restricting, we mean they're restricting what they're eating. They're deliberately trying to eat as little as possible in order to lose weight. People with anorexia nervosa may also engage in binging. So binge eating is defined as eating more food than one would normally eat in a particular situation. Binging can often be triggered by restriction, because when we're starving ourselves, we can then become so hungry that we then eat more food than we intended to eat. People with anorexia nervosa can also engage in purging. And purging means any inappropriate behavior or unhealthy behavior that's meant to try and prevent weight gain. And so if we look at bulimia nervosa, individuals with bulimia nervosa may not actually be low weight, but they do engage in binge eating. And then when that happens, they engage in some inappropriate behavior to compensate or prevent the weight gain. So commonly that may include things like self-induced vomiting, that may include things like laxative abuse, that may include restrictions. So they again try to cut down on what they're eating. It may also include excessive exercise to try and prevent weight gain, and also to try and encourage weight gain as well. So these two are the disorders of body image. And then ARFID is a different eating disorder, or avoidant restrictive food intake disorder. This is a problem with eating that's not related to body image. So there's some other reason why a person's afraid to eat or not able to eat enough food. So some of those reasons may include anxiety or fear. So a person may have had a choking episode and then they're afraid to eat because they're afraid to have another choking episode. It may be related to sensory intolerances. So people are unable to tolerate the texture of food, the flavor of food. Some people have difficulty tolerating the sensation of swallowing food. I've also had a number of patients that just don't have hunger cues like most of us have hunger cues. So most of us eat intuitively. Intuitive eating means my body tells me I'm hungry, so I go eat something. And when my body's not telling me that I'm hungry, then I'm not eating because I'm not hungry. But I have had a number of young people that just don't have those cues. And unless someone is making them eat when they're supposed to eat, they don't eat. Or they're easily distracted by things like video games or other things, and they just don't either have hunger cues or respond to them. And then also as part of this disorder, or what makes it a disorder, is this feeding disturbance must result in some negative consequence. So whether that's weight loss, growth stunting. Growth stunting means that young people are not getting as tall as they could be, that their growth is delayed because they're physically don't have enough energy to grow. It can also lead to nutritional deficiencies, so vitamin deficiencies or other nutrient deficiencies. Some young people with this condition are dependent on feeding tubes, so they actually cannot eat enough, and they have to have a tube that goes from their nose to their stomach so that they can be fed. Some young people can eat enough by mouth, but they have to use supplements, things like Ensure or Boost, which are called real meal replacement supplements, and they have to have those every day in order to eat enough to be well. But the key difference between ARFID compared to anorexia nervosa and bulimia nervosa is ARFID's not about body image, and the other two are about body image. And then finally, very briefly about binge eating disorder. So binge eating disorder is also considered to be a disorder of excess. People are eating more food than they need to eat. Binge eating itself is defined as in a 2-hour period or in a single sitting, people eat more food than they normally would in that situation, and there's a lack of control over the eating. So the individuals with binge eating disorder feel, I can't stop myself from eating even though I want to. Binge eating can be triggered by many things. So we talked about in bulimia nervosa that, or in anorexia nervosa, when people are restricting, trying to cut down on what they're eating and they're starving, our hunger cues come back in a big way, and some people may overeat at that time. But binge eating can also be triggered by boredom, and it's often triggered by stress, and that's called emotional eating. Or to put it another way, we're using eating as a coping mechanism. We're trying to use eating because it makes us feel better and it reduces our stress, if only briefly. And then the other part of the disorder is when a binge happens, people are eating more rapidly than normal. They often eat until they're uncomfortable and in pain. And it has a lot of effects on mental health because there's a lot of embarrassment, shame, and guilt that comes along with binge eating. And in general, all eating disorders are generally can be associated with a lot of shame, and therefore people try to hide them from other people, which can make it difficult for parents to realize that their child may be experiencing an eating disorder. Now, when we're talking about the negative physical effects, as well as mental effects of eating disorders, particularly disorders like anorexia nervosa, bulimia nervosa, and ARFID, where people are not eating enough food, they may become malnourished. And when we're malnourished, that affects our entire body. So this is a very short list, but not a complete list of all of the different effects of malnutrition. So there's effects on the brain. There can be permanent decrease in IQ if it goes on long enough. And on MRI studies, we can actually see the brain shrinks when people are malnourished. Parts of the brain won't work as well as they were before, so it can make it harder to concentrate in school. It's harder for us to regulate our emotions, so people may be more prone to anger or to mood swings because the part of our brain that regulates our emotions doesn't have enough energy to do its job. Malnutrition can also lead to heart damage. And one of the most common reasons a young person gets admitted to a hospital is because their heart rate is so low, they're at risk of a cardiac arrest or their heart stopping. And that reflects damage that's done to the heart because of malnutrition. It can also cause liver damage and kidney damage. It can lead to osteoporosis. So osteoporosis is a disease that we tend to associate with older people, and it's really a weakening of the bones that can lead to fractures like hip fractures. But for individuals with eating disorders who've been malnourished for a long time, these things can happen in their 20s or 30s. So those fractures that we associate with people in their 70s or 80s may be occurring for some people in their 20s or 30s. Chronic malnutrition can also lead to problems with fertility or the inability to have children. We discussed with ARFID as before, it can cause growth stunting. Young people stop growing. Puberty can stop because the body doesn't have enough energy for that. And as we also discussed before, it can also lead to vitamin and mineral deficits. So one thing that I see not infrequently is scurvy. Scurvy is a deficiency in vitamin C. And while many of us have read about that, in the naval age when people were on the high seas and didn't have access to vitamin C, unfortunately, we do see that today, and we do see it in our populations who are malnourished. And of course, there's many other vitamin deficiencies as well. So some of the other consequences of eating disorders, both related to malnutrition, but also related to the disorder itself. So often there's a lot of trouble in school. Young people who are malnourished are having trouble concentrating. They may look like they're not paying attention in class, or they may not be able to pay attention. We do see frequent mood swings, angry behavior, aggressive behavior, and that's also related to changes in the brain. I think many of us are familiar with the concept of being hangry, hungry, and angry. And that's a real thing that reflects biochemical changes in our brain when we're not eating properly. Unfortunately, when one has an eating disorder, one is at risk for every other mental health disorder as well. And in mental health, we call those comorbidities. So eating disorders can also coexist with depression, anxiety, drug and alcohol use, self-harm, and suicidal thoughts and attempting suicide. Eating disorders also tend to cause a lot of social problems because many of our societies in the world, many of our cultures in the world, many of our religions have food-related components or food-related celebrations. So whether that's Christmas, whether that's Eid, if one is a Muslim, whether that we're referring to, when we start dating other people, we often go out for food. When we're hanging out with our friends, we often go out for food. And when you have something that interferes with eating, when you're not able to participate fully in those social environments, that leads to a lot of social problems and also contributes to mental health concerns. And then, of course, the most serious consequence of eating disorders is death. And unfortunately, anorexia nervosa in particular is the deadliest mental illness that there is. There is no other mental illness that even comes close to the mortality rate of anorexia nervosa. It's absolutely terrifying. Now, thankfully, in the teenage years, death is rare. So teens with anorexia nervosa, although death is possible, it's thankfully very rare. But unfortunately, it is not rare in the 20s and in the 30s. And so individuals with anorexia nervosa in their 20s and 30s have a 20% risk of dying every year, which, to put it into context, that's about 10 times or more the risk of death for people who have depression. This is absolutely terrifying, and there is no more serious mental illness. Of course, they're all serious, but no more serious one than anorexia nervosa in particular. Now, there are some warning signs that I'd like to tell for parents and caregivers out there, for anyone who's interacting with children and teens, really. And so many parents tell me, how do I know? How do I recognize that my teen may have an eating disorder? Well, your number one clue is weight loss. There is no reason why any child or teenager should lose weight ever. Even in our weight management programs, and I am a physician in the weight management program here at the Scarborough Health Network, we never talk about weight loss. We do talk about weight management. We talk about improving weight-related health conditions, but we never talk about losing weight, because losing weight as a child and a teenager is so much more dangerous than it is for an adult, because children and teens are growing rapidly. Their metabolisms are much higher than adults. Their bodies need a tremendous amount of energy to grow, to develop, to learn, to play, to go through puberty. And so that's why really there's no reason why they should ever be losing weight. And as a pediatrician, every time a parent tells me that a young person's losing weight, that's immediately a red flag to me. That means I need to ask more questions. Of course, not all of them will have an eating disorder, but I need to ask more questions because it's always a red flag. And also, we need to be very clear as well that rapid weight loss, even if a person was obese or overweight and they don't become significantly low weight, rapid weight loss can cause significant damage to the body, even if they're not low weight. So this is a key warning sign. But some other signs that parents might be aware of are sudden changes in the diet. So I often hear from parents that my child used to eat everything, and then suddenly they started cutting out entire food groups. They may have changed their diet and identify as a vegan. Now, that's not to say that every person who follows a vegan diet has an eating disorder, but really that change in behavior that parents may notice is a warning sign. Young people often also develop a sudden interest in cooking or grocery shopping. They may become very directive because they're trying to force their parent to choose lower calorie options, to use less oil, less butter. And it's often a profound change. Parents are like, they never were interested in cooking before, and now they're always in the kitchen, always looking over my shoulder, always telling me what to add or what not to add. And it's a big change. Certainly another red flag for me as a pediatrician is any young person who's calorie counting. That should be considered a red flag. Outside of perhaps an assignment for health class, there's really no reason any young person should, well, probably most humans should be calorie counting. Many parents notice that their young person starts frequently weighing themselves if you still have a scale at home. Many young people also engage in something called body checking. So they're always looking at themselves in the mirror. They're often like poking at their stomach, measuring their thighs, measuring their arms, checking to see if they've gained weight. And so frequent body checking parents may notice as well. Dramatic change in exercise habits and really excessive exercise is a warning sign for parents. So, I commonly hear that, my child was at a practice for their sports team, and then after they practiced for 2 hours, they went and ran a kilometer. And that seems a bit odd. If you were just exercising hard for 2 hours, why did you feel the need to also run for a kilometer? So again, the change in habits can be a major warning sign for parents. And then, as we talked about before, there's a lot of shame and guilt that comes along with having an eating disorder, and that often leads to young people trying to hide their bodies. So wearing very baggy clothing. Many parents have observed that when it's summertime and most of us are wearing shorts and short sleeves, there are young persons in sweatpants and hoodies and very baggy clothing that just seems really out of keeping with the weather and what other people are doing. So these are all warning signs that for parents and caregivers that their young person might be experiencing an eating disorder, and hopefully will prompt more conversations between parents and their kids in terms of, why do you feel this way? Why is this happening? Are you okay? How are things going? And then may also lead parents to reach out to their family doctor, their pediatrician, and say, I'm worried about this. What do you think about this? But these are some of the warning signs to be on guard for. Now, I'll just talk very briefly about the principles of how we treat eating disorders. So the first principle is helping with physical recovery, and that often means we have to restore weight or help people regain the weight that they lost. And really, this has to be the first step, because as we talked about before, malnutrition and weight loss has a lot of effects on the brain. And we know from good research studies that psychological treatments, whether that's therapy, as in working with a therapist, or whether that's a medication for mental health, like an antidepressant, let's say, these actually don't work when the brain is starved. Both the medications and the psychological therapy. And this is frustrating, I think, for many parents as well, because I have many parents say to me, well, if someone could just talk to them about eating, they would start to eat more. And unfortunately, that's not going to work, because when the brain is starved, no amount of a psychological treatment is going to make a difference. Their brain just can't handle it. So we first have to focus on the physical recovery, and then we can move on to addressing the underlying psychological causes. Now, the second bullet point is something called medical monitoring. Medical monitoring means seeing your regular primary care provider, family doctor, nurse practitioner, pediatrician on a regular basis, so that the young person's weight and vital signs can be monitored. Because as we said before, unfortunately, many young people with eating disorders need to be hospitalized, and it's often because they're extremely low weight or their vital signs are dangerously abnormal. And so they do need to see a healthcare provider on a regular basis in order to make sure that they are well enough to stay at home and that they don't need to be hospitalized. And unfortunately, again, that is frequent. And then there's different psychological treatments that are being used to treat eating disorders. The first one is called family-based therapy. This is the method in teenagers that has the most evidence to support that it leads to what we call remission. Remission is where young people are able to maintain a healthy weight, they're physically well, and we hope complete remission where even those eating disorder thoughts go away. Family-based therapy is, the principle behind it is essentially when a person has an eating disorder, they cannot make the right choices about food. The disorder will not let them make good choices, and we can't ask them to do that because we know the disorder is too strong and it's not going to let them make those choices. So in this therapy, parents and caregivers are given all of the power around nutrition, choosing what is eaten, when it's eaten, how much is eaten. We have to take that power away from the young person because that's the only way to take power away from the eating disorder. And we have to give that power to parents and caregivers. But over time, of course, that's not something we can do forever. Over time, as young people recover, we start to give them back some of the power around nutrition. There's also a type of cognitive behavioral therapy for eating disorders. Cognitive behavioral therapy focuses on thoughts. And so the focus of this therapy is addressing some of those eating disorder thoughts. Why do they feel the need to lose weight? Why do they feel the need to be very thin? Why is that better? And addressing those underlying thoughts. There's also something called dialectical behavior therapy. Dialectical behavior therapy focuses on emotions and distress. And we know that when people have an eating disorder, there's often a lot of distress, there's a lot of fear, there's a lot of anger. And so this therapy hopes to help young people manage those emotions better so that they can get the right nutrition. There are ongoing studies looking at cognitive behavioral therapy and dialectical behavior therapy for eating disorders. They are treatments that are being used widely across the world, but we don't yet have the same evidence to say that they are as effective or more or less effective than family-based therapy. But there are a mix of treatments out there that young people can access for treatment of their eating disorder. And as I said earlier, the goal of treatment as a whole is we hope young people go into complete remission. Complete remission being they're able to eat enough to have a healthy weight, they're physically well, and we hope that those eating disorder thoughts also have gone away. And just to say, in comparison to partial remission is that state where a young person is able to eat enough and to maintain a healthy weight and be physically well, but they still have some of those eating disorder thoughts and they still have to fight against those thoughts. But the goal of these treatments is complete remission. So then if you know or you suspect that your child has an eating disorder, how do you access this therapy? What can you do? Well, there's really two options to access therapy in the province of Ontario. One would be private therapy. So that therapy that is paid for either out of pocket or through private insurance. That often involves seeing a psychologist who has experience treating eating disorders. There are social worker therapists who have experience treating eating disorders. There are registered dietitians or nutrition experts who have experience treating eating disorders. Private therapy can be expensive. These are not disorders that are easily treated. On average, the first round of treatment for a young person with an eating disorder, particularly anorexia nervosa, is 6 months to 1 year long. However, and they're often weekly sessions as well. So that can become very expensive. I think most people will realize too, though, that trying to access private therapy generally is faster than trying to access one of the publicly funded eating disorder programs. So these publicly funded eating disorder programs, these usually involve a multidisciplinary team. So there's a number of healthcare providers on the team. It may include doctors like myself, nurses, nurse practitioners, dietitians, also psychologists, social worker, therapists. All of the costs of the program are covered by OHIP. They're funded by the government. Unfortunately, especially with the dramatic increase in the incidence of eating disorders that we talked about earlier, there's lengthy wait times to access these programs. And people can sometimes be waiting for years to access this therapy. Unfortunately, the government has not made any significant investments in eating disorder treatment, even though the data is very clear that the shadow pandemic is still going on. So there are lengthy wait times to access the publicly funded programs. Also, the publicly funded programs tend to serve a geographic area. And so people don't really have a choice in which program that they're assigned to. They're assigned to the program that covers their geographic area. So there's not an ability to switch programs or to move between programs really. I do want to give you some information resources that I think are helpful for parents and caregivers when we're trying to understand what is an eating disorder, when we're trying to understand why are the doctors so worried about this, why are they so worried about my child, what can I do about this, how do I support them? So I do recommend that people access the National Eating Disorder Information Center, which is called NEDIC. NEDIC is run through Toronto General Hospital downtown, and the website is nedic.ca. BC Children's Hospital has created a fantastic website called Kelty Eating Disorders, and that's available at keltyeatingdisorders.ca. This website also has some good tips and tricks for parents about So my child has an eating disorder and they don't want to eat. How do I make sure that they eat? So there's some training videos online that parents find helpful. Feast is an international organization, and is really a peer-led movement where families leading families on how to empower other families and to support each other with eating disorder treatment. And you can access their resources at feasted.org. And then my colleagues from CHIO have created a website called Understanding Eating Disorders in Adolescents. And they have a series of education modules that are free online. And parents who complete all the modules gain a significant amount of information about what are the eating disorders, what are the consequences we're worried about, and what do we do about this. And you can access those modules at canped.ca. There's many other resources out there, books, private therapists that people can access as well. But I think this is just a good place to start for families who are concerned that their young person may have an eating disorder. So that is the end of my presentation. Let me just stop sharing my screen. And then I am happy to discuss questions if people have them. So I would invite you to feel free to type your questions in the chat. I think Rachel or myself will read them, and I'm happy to address them. There's very few of us on the call tonight, so I'm also happy to have a discussion as well. But up to you guys. And thank you so much for attending tonight.